We've done quite a few podcasts in this series, but I think this is probably going to be one of the most important ones because of the sheer number of people that are affected by long COVID. So I'm delighted to have Ondine and Vicky with me today. And Ondine, if you could introduce yourself first of all and tell us why you're here.
Hi, my name is Ondine Sherwood. I'm one of the co-founders of Long COVID SOS, which is a campaign and advocacy group for people with long COVID, and we've been going for about a year. I contracted, I assume it was COVID-19 at the end of March last year. Obviously, well, at that time, could not get tested and failed to get better. Thought I was better several times, but unfortunately, it kept coming back. And I think now, 16 months on, I do feel that I'm really reaching the end of the tail, I hope.
Indeed. And Vicky, welcome. Tell us about yourself, please.
Hi, I'm Vicky van der Tocht. I'm from the Netherlands. I got sick in March last year, and with all the symptoms that we now know about. So I had the pneumonia, tired all the time. I had really bad circulation issues, so I couldn't really walk for 3 months, or had a lot of trouble walking, and also neurological symptoms. And I really didn't really hear anyone in the Netherlands talk about any persisting symptoms. So I started reaching out around June and July to see if there are other people experiencing this, and whether or not healthcare providers actually knew about any of this, but it wasn't known. And so I got into action and started speaking out about this. And it actually took a long time for things to get started in terms of advocacy. But luckily now, since the beginning of this year, we have a work group in the Netherlands. It's the Long COVID Netherlands PASC. And we started a petition that we just 2 weeks ago got to present to the full government. And finally, long COVID is also acknowledged. So a lot has happened in the last 1.5 years.
Excellent, yeah. And I noticed your English is considerably better than my Dutch as well. So thank you for that very clear message. So, Ondine, maybe if we start with you, if you don't mind. If you go back to the last day you remember in being in perfect health, and then when was the first day you kind of noticed something was wrong? What do you remember about that? And what was the sort of the longitudinal process after that? Ondine first, please.
Okay, so it was about, I think it was March the 27th. And I remember I went out and jumped on my bike, and I thought that I didn't really quite have the strength that I normally had on my bike. So I felt a little bit fatigued for some strange reason, but it was quite mild. And I remember I went into a fishmonger, and I was quite anxious at the fact that this guy wasn't wearing a mask, and I was quite close to him. And I felt quite worried because at the time, we were in lockdown. I think we were just going into lockdown, and we didn't even know how many cases there were in the UK, and it was a very, very worrying time because it was a novel disease and we knew so little about it. And I really didn't. I'd really been careful. I thought I'd been very careful to protect myself. And that evening, I felt okay, and then suddenly, quite late, I was suddenly hit by this wall of fatigue out the blue. Like, I think I really need to go to bed. And I also got other symptoms. I became very cold and shivery, and I felt very flushed, and I felt very anxious as well. And I probably should have taken my temperature, but I just didn't. I just got into bed. And I remember waking in the night and wondering if I had a fever. I'm not sure that I did. And in the morning, I didn't feel terrible. And I thought, maybe this is some kind of anxiety attack because of the situation in that shop. And so I got up and got dressed, and then during the day suddenly it all came back, and it was like that for the first few days, and that I would feel okay, and then I would feel terrible. And so one minute I could be talking to someone, the next minute I had to go and get back into bed again. Consider myself fortunate that I didn't get the very nasty respiratory symptoms. I had some gastroenterological symptoms, and I have since developed some vascular stuff like the COVID toes and so on. But it was mainly the fatigue. But it's not just being tired; it's this overwhelming fatigue that knocks you for six. And that can be brought on by just talking to somebody. So I could have a conversation with someone for a half an hour and that would just wipe me out for the rest of the day. But after about 5 days, I decided that I was feeling much better and I was going to go for a little bike ride because I thought, well, this probably wasn't COVID. You know, I didn't have the high temperature and persistent cough. And I went off on my bike intending to just do a 20-minute run around. And I was enjoying myself so much that I did a 2-hour bike ride around London. And when I got back, I was really floored again. And the next day, and it was like that. So I would feel that I was getting better, assume I was better, let's get back to normal activity, and then it would come back. And I remember thinking, well, this time I'm going to wait 3 days before I do anything, because after 3 days I'll know that I'm well again. And that didn't work either. So it was a sort of relapsing and remitting situation. And of course, as Vicky mentioned, we knew so little about this, and we didn't know about long COVID. And despite the fact that there were the post-viral sequelae from SARS, which were quite lengthy and quite severe, we don't seem to have been prepared for this. And there certainly wasn't any, well, there was no warnings, public messaging, but there still isn't that much public messaging about long COVID, unfortunately. And in the end, I joined a support group because I thought, is this what's going on? I didn't understand it. It didn't seem to be COVID in terms of the symptoms, but why is it coming back the whole time? And that's when I joined a support group, the Body Politic COVID-19 support group. And there I met all these people who were going through worse and similar, and who were in many cases very young and having some really nasty symptoms and completely unable to get any help. And that's why eventually a group of us got together and decided we had to take some action. We had to get this out there. We had to get this condition recognized, accepted, acknowledged, and then we added research and rehabilitation.
Well, I saw you nodding along there, Vicky, quite a bit. I mean, I assume there's commonalities in the experience you had back in March 2020 as well, were similar experience to Undine. Would you like to tell us how you first became aware there was something wrong?
Yeah, my experience is very, very similar to Undine's, especially in the first couple of days, I think. It was similar in the sense that I knew that there was something odd about how I was feeling. I mostly had like red patches and hot patches in my face that I couldn't really explain. And I felt a little bit feverish, but I didn't have a fever. And this was even before the first patient was confirmed. So COVID was not even like on my radar that much. I knew that it was happening in China and in Italy already, but as the first patient wasn't confirmed, I was fully convinced that once that was the case, we would hear about it and quickly. And so therefore, in the first couple of days, it didn't dawn on me that it could be COVID. But we had a family birthday that I still went to. And that was probably the worst mistake that I could have made in that at that time. But quickly after, those mild, strange symptoms turned into a real fever. So I've been on the couch with a fever for about 2 weeks. I developed pneumonia. And aside from that, and this is a symptom that is not that much talked about, but I developed a rash all over my upper body. And that started off as, it looked like shingles, but it couldn't really be explained by my GP. They kind of had to do a diagnosis based on WhatsApp, on photos I had to send through WhatsApp because I couldn't come into the GP office. But they couldn't really, they couldn't diagnose it. And so they didn't know how to treat it or what type of medicine to give me. And eventually they gave me an antibiotic that you cannot really prescribed to someone that has anything viral. So it made it worse. And really for the first 3 months, I've had this rash become worse and then lessen, but it kept coming back. And I still have it to this day. I guess this really depends on what part of the body the virus affects. It's different in everyone. And of course, the long-term symptoms after 2 months, I think for me, also my heart became affected. So I was having palpitations and I kind of felt like my heart was skipping beats. And I tried to get an ECG, but it was really difficult to get to a hospital because hospitals were overflowing as well. So that was really the first couple of weeks. That's kind of pre-long COVID still, because those symptoms are different from these as well.
Yeah, dear me. So Undine, you had a remarkably unpleasant acute phase, but just lasting for 5 days. Whereas Vicky, your acute illness was actually quite a bit longer,
Yeah.
and you got the severe, you got the more severe pneumonia as well. Were you having breathing difficulties, Vicky, at the time?
I did. It was mostly for the first 2 weeks, and it was breathing difficulties because of the pneumonia, but also just because I was so stuffed. So I had to wake up during the night and sit up because I felt like I was like, yeah, kind of choking on like everything.
Sure.
Not a nice picture, but that kind of gives you an idea of how bad it was, because yes, sometimes it felt like I wouldn't make it through the night.
I mean, I've heard so many people say that they felt that they were going to die, and they felt that all the way through during their experience of long COVID as well, because for some people,
Yeah.
the long COVID symptoms are bad enough to make them fear that they're not going to make it.
And I think the anxiety probably is part of it, isn't it? It's almost, you would be anxious to a degree because you're ill, and that's an anxiety provoking situation. But it almost seems that the anxiety is almost one of the symptoms, as if it's the long COVID or the COVID affecting the mind somehow. Do you think that's true? Like a disproportionate anxiety. Undine, did you find that?
I think, well, I'm not going on my own experience, but there's certainly cognitive and neurological effects of the virus and long COVID. I mean, there's absolutely no doubt that both acute COVID and long COVID has impacts on the neurological system and the brain. And I think there's a problem in that some of the symptoms could be similar to symptoms that people have when they're anxious. And this has caused a lot of people to be diagnosed with anxiety when they were presenting with long COVID symptoms.
Right. Yeah.
Which is very problematic because it meant they couldn't get any care. Yeah. And of course, there are people who have literally had to fight for months to get themselves heard and to be listened to by the doctors, and not to be dismissed. And people were dismissed for long periods, and that in itself is a kind of a trauma, which is not going to help your recovery. But I think it's important to differentiate between neurological symptoms and pure anxiety caused by the fact that you're ill. I think that many would argue that depressive illness is caused by physical changes anyway. But we've certainly seen physical changes in people's brains, even people who've recovered from COVID. There was the biobank study. But yes, of course, having these ongoing symptoms for months and months, knowing that there is no cure, being presented with doctors who shrug in the early days, or in even now saying, well, we can try this, try breathing exercises, try. There's no real pathway in a way, because there's no treatment. That is not going to result in people having a carefree attitude towards their illness, because the illness isn't being managed. And of course that does increase anxiety, but I think there is too much of a doctors and other medical workers are too ready to diagnose people with anxiety and panic attacks. And I know that's happened to somebody I know very recently, whose daughter was very sick, and they've been told that it's a panic attack and that they seem anxious when there's clearly something going on. There's clearly something worrying, and this has been a bit of a battle for anybody advocating for long COVID or suffering from long COVID, is to actually get over that, so that your physical symptoms are taken seriously. And we do know that, because of all the studies with scans and imaging, to show that there are there are physical manifestations. It's caused by something going on, which is tangible, and blood tests as well, showing increased autoantibodies and cytokines and so on.
I'm really glad you brought that point up, actually, because the most fundamental mistake you can make in this thing is to attribute something to a psychological cause when it has an organic basis. And from the clinical features we've been learning about, I mean, there is no debate this is an organic illness, the same as a bacterial infection or the same as appendicitis or the same as any other physical illness. I mean, but what about you, Vicky? How bad was your sort of what you might call sort of psychological distress in the early stages?
I think the psychological distress was not necessarily due to the virus itself, but of course you go through a lot of anxiety when you know that you need care. Like in my case, I had double pneumonia and I couldn't even walk, and still I couldn't get to a hospital. I literally called the hospital multiple times and they told me, just call back when you cannot breathe anymore, or when you cannot speak one sentence without grasping for air. And that is a thing that'll make you anxious, all right? And aside from that, just one thing I'd like to mention,
please,
is that throughout when I got sick myself, I also lost my dad. That was when I was in quarantine, and he had been sick for a long time. But that, of course, is a very distressing situation. And it was. Someone asked me, how was your initial disease? The first time I got into a GP office and actually was able to come in, and they put that in my medical dossier. But ever since, every single appointment I've had, doesn't matter which type of symptom I came in for, they started off every single appointment with, oh, I see that you recently lost your dad. That must be the reason why you're suffering from these symptoms. And let me just tell you, like coming in with pneumonia and then someone reminding you that your dad died over a year ago and attributing your symptoms to that, yeah, you probably have some idea of how angry that makes me, because the one has nothing to do with the other. Like being sad doesn't give you pneumonia.
No.
And this is just one example, but I hear from a lot of long haulers that GPs are really grasping at straws of like point out reasons for them to have these symptoms that have nothing to do with COVID without looking for what is actually going on.
Well, we're certainly very sorry for your loss. It's a terrible thing to happen. But of course, you were clearly able to differentiate between the effects of the bereavement and the physical effects again.
Yeah,
we're clearly talking about a biological disease here, aren't we? So the heart features that you had, Vicky, sound particularly unpleasant. How long after your first symptoms did that begin, the palpitations and the irregular heartbeat?
I think about 7 weeks after I got infected.
Right.
But it's difficult to say because in my case, I couldn't get tested. When I got sick, only people in vital professions could get a test. So I think for me, it's about 7 to 8 weeks. And that really stayed that way, like with that severity for, I think, about 2 months. Now it's a lot less, but it's still there when I do too much, when I'm too active, or when I sit up for too long, then I would still get like these jabs in my heart area, and nobody is able to figure out, not with the type of examinations that I've done, what is actually going on there.
I mean, clearly you need a full cardiac workup with that. You need 24-hour ECG. You need investigated. This is the lack of exercise tolerance, of course, could be tied in with the heart problems. It needs full investigation, doesn't it?
Yeah, exactly.
Yeah. Thanks for that. And again, just as further evidence, as if we needed it, but we don't. But this is just showing this is a biological condition. There's a problem here that's affecting the heart. And
can I just say that one of the problems is that the diagnostic tests that are generally used often pick up don't pick up anything. So people have ECGs, some people have echoes, and it doesn't show anything.
Right.
It's only when they get an MRI that you can see what's going on. And of course, for many people, an MRI it's not going to be offered to them. And a lot of people with long COVID had clear X-rays, and so they did an ECG and an X-ray. So there's nothing wrong with you. You know, they're an A&E with all sorts of, you know, chest pain often, and extreme breathlessness, and yet there's nothing to show on the standard tests that there's anything wrong. So they get sent home and told it's anxiety or just go and rest. And it's only now that they're looking closer using more specialist CT scans and PET scans and so on, that they're finding blood clots in the lung, clots even in the brain, and it's only with these more specialized tests that it's actually coming to light what's going on. So, and this has always been the problem, that there are no tests for long COVID. As soon as you say, well, there's no test, then everybody says disease, you know, there's no test. People are just, I mean, unfortunately, there are many out there who believe that people claim to have long COVID because they don't want to work, when certainly the many people that I've met, they're desperate to get back to work. They want their old lives back. They don't want to just sit there at home not being able to do anything. I mean, it's absolutely, you know, ridiculous that is the prevailing view amongst some sections of society, unfortunately.
And this is often what happens. You go to a GP, they'll run through a standard tick list. You go into A&E, we'll do some blood tests, we'll take an X-ray. There's these sort of standard tests that people get, but I think you're clearly saying that these are not sophisticated enough to show the nature of the pathological changes that are happening with long COVID, causing the shortness of breath. So very small blood clots in the capillaries, perhaps, or the chest pain where the disease might be at a very fine level in the heart that's just not detected on these standard tests.
Yes, I mean, it seems that myocarditis isn't going to be picked up. I doubt it's going to be picked up on a chest X-ray. I think you do need an MRI. And looking for the inflammation and all that sort of thing. And there's all the vascular. I mean, COVID definitely attacks the endothelium and the vascular. It's not, you're not going to pick that up using sort of bog standard tests.
No, absolutely. You need quite a sophisticated medical analysis to do that. The last thing I'd like to do really in terms of talking about your personal experiences is we'll start with Vicky maybe. How are you now, Vicky?
I'm a little better. The inflammation, I had an inflammatory response really for 1.5 years almost. And that after I got the vaccine, got a little less. But I have to say I got my vaccine 3 weeks ago, so I'm not quite sure if I can attribute it to that or that it will come back. But at least I'm really happy with that. I still have long-term symptoms, and I've also developed some more serious effects because of this. It turned out that I developed multiple types of psoriasis due to getting long COVID, and I'm doing examinations now to figure out like what is to be done about that, and to what extent is there any type of treatment for this how to call it, multi psoriasis
syndrome.
So that is something I'm trying to figure out now. That information is really new, only a couple of days, so I'm still kind of processing that.
Now, I mean, clearly before this started, you were young and fit. You still are young, but how fit are you? How fit are you now? I mean, how far can you walk?
I can walk further. I can walk for about 10 minutes, but I still, after walking for about 10 minutes, I get this pain in my diaphragm that keeps playing up. It doesn't seem to matter how long I rest, like that pain is just there and kind of gets re-triggered every time I exercise or am somewhat active. And I've been able to stretch that time that I was able to walk, because first I couldn't even get to the end of my street. But now, like, I seem to be plateauing, to stay in COVID terms, at around 10 minutes. So that is still a problem. And like Undine said, even having a conversation, I'm pretty sure after this conversation, I will have to nap again. That is still very much an ongoing symptom.
I'm very aware that both of you are making quite a bit of effort to do this, by the way. So people, I'm sure people are appreciating the amazing insights that you're giving. So have you been? I mean, before that, Vicky, presumably you could walk for hours. You were fit.
I actually did everything by foot. So I don't have a driver's license. So I'm actually used to walking for about 2 to 3 hours every day. I can walk into the city center over here in about an hour. So I used to do that a lot. So yeah, I was very active, and I didn't have any underlying conditions. Not that I know of, at least.
Yeah. And that of course is part of the frightening bit. You were young and healthy, and then this basically descended on you. I mean, have you been able to work over the past 18 months?
I've actually started a new job. I'm actually doing research into long COVID now, and the only reason I'm able to take this job is because my employer knows the severity of long COVID and is willing to grant me that flexibility so that I can hold a job. Without that flexibility, I don't think I would be able to get back to work. So I think that is a very important thing to know, and also for governments to keep in mind that is something that they should look into in terms of getting people back to work.
Absolutely, thank you. And Undine, in your case, I mean, how long was it before you realised this was a chronic condition, and how's that been over the last 18 months, and how are you now?
Well, I think it's been a glacially slow improvement, but I think I'm nearly there. I noticed after about 6 months that I was able to do a bit more in terms of exercising. Prior to that, I'd go for a walk, and if I walked at the pace I used to walk at beforehand, I would just, knock myself out when I was halfway there, and I'd have to turn around and come back. And then I did notice that I could do a little bit more, and I was very, very careful not to push it. But I still find that the cognitive stuff, particularly, I mean, this is fine, but some of the meetings where you're concentrating on what people are saying, there's all this chat going on in the sidebar, and you've got messages coming in, and I find that exhausting. And I think before, I'm pretty sure that I used to be able to manage, although I wasn't doing so much Zoom in the old days. I feel like I'm nearly there. I haven't gone back to running. I don't dare. I think the way I feel is there's always the possibility of a relapse around the corner. So I don't want to ever say never. I did have a mild relapse a few weeks ago where all the symptoms come. It's not just the fatigue, everything else came back, and I felt lousy for a few days. I don't want to trigger that again. But I feel like I'm out of the woods. But going back to what Vicky was saying, I think that the employment issues are big. And we do need to, as a country, and that would include your country, Vicky, look at what are the results of long COVID, of so many people being debilitated. How does this impact on the workforce, on the economy? And I know that workforce organizations are starting to notice this and are starting to wonder about how to take steps to mitigate for this absenteeism, which is inevitable, and difficulty finding skilled workers. And of course, many people with long COVID across all professions, but they can't do their jobs and they can't really perform as they did. And they are not contributing to the economy anymore. They're taking from the economy, unfortunately. They may be claiming benefits, and of course they're consuming NHS services. So people have gone from relatively young, healthy contributors to the economy to people who unfortunately are consuming benefits and healthcare. And this is why we really do need to take steps to prevent more people getting this condition. And there are predictions of 500,000 people joining the ranks of those with long COVID over this wave. And the only way at the moment to prevent it is to prevent infections in the first place. And unfortunately, the way things are going, that's not happening. And it's all very well saying that we haven't broken the link between infections and hospitalizations and deaths, but the link has been reduced. But we still have long COVID, and we may find that people who are vaccinated and are getting breakthrough infections, and this is happening quite frequently, we don't know for sure. how that impacts the rate of long COVID. There are some studies out and coming through which suggest there is a reduction in the prevalence with people who've been vaccinated. But even if there is a reduction of 30%, which a study from KCL has suggested, we're still looking at maybe 9-10% of people sick for longer than 12 weeks. So it's not great. And these numbers are massive. You know, we're heading towards 100,000 cases a day.
Oh, we're going to get there. Yeah.
That could be 10,000 cases a day of long COVID.
And these are people who are young and fit now, just as Vicky was at the beginning of March 2020.
Exactly.
So I was going to ask this question, Undine. Are governments taking potential morbidity of long COVID into account in their projections? But I think you've answered that question. The answer is no, they're not.
There are government bodies are interested. I mean, the Office for National Statistics has done a huge amount of work on long COVID and have really helped us understand the prevalence of long COVID. There are people in government who are starting to look at modelling the impact, but what we're not seeing is enough messaging from the top. And that's why young people are streaming into nightclubs, because they don't feel that they are vulnerable. They feel that they're not going to be, it's not going to matter, they'll get a little bit of flu and it doesn't matter. And they've been told by the government that you don't have to wear a mask and you can go to a nightclub. And they're not really aware of the truth about or the facts about their risk. And so it's very difficult for people to be cautious, exercise caution if you're not informed. And so you can't make the right decisions as to how to be cautious if you don't have that information. And so there's been loads of us calling for long COVID stats to be reported daily along with hospitalizations and deaths. I know there are reasons why it's not so easy. You can't really say X number of people have now got long COVID today because it's all done on sampling and we can't count it in the same way. But, you know, it would help.
I think a lot of people in the UK are very focused on the acute illness, and young people are likely to get a very mild acute illness and not be symptomatic. But of course, we do know there is a significant risk, even with mild acute COVID, that long COVID can complicate that. And that, I agree, it does seem to be a national blind spot. I'm with you 100% on that. I mean, well, what's the situation like in the Netherlands, Vicky, for that? Is the government aware of this risk, or do you get the feeling there's a limited amount of awareness of what's going on and the potential risk?
They are aware of it, but that doesn't mean they take it into account in terms of strategy. So really what is going on, you say a national issue, it's really an international issue. Long COVID is not being taken into account in terms of the whole COVID strategy. So in the Netherlands, we've had our press conferences, and every time with the press conference, we were hoping, like with our group, we were hoping that they would mention long COVID, but they never did up until, last week or 1.5 weeks ago, because there was this scandal that our government actually suggested that young people could get the Johnson vaccine and could go partying right after. And so we've had super spreader events all throughout the country because, all these people went out straight after getting the shot. Of course, a lot of people got COVID due to that, and some of them, mostly young people, will go on to develop long COVID as well. And because they had to kind of make excuses or like apologize for stating that, for that going so horribly wrong. With the next press conference, they could talk about long COVID, but still with that acknowledgement, they still didn't actually implement any measures. Like we still don't have masks in indoor spaces. Clubs are still open. So it kind of seems like a way to get people to be a little bit more cautious, maybe, but there's nothing in place to actively communicate about the dangers of long COVID, specifically to young people as well.
I mean, that idea that you'll be immune straight after a vaccine is a failure of such basic science. I mean, that is schoolgirl science, isn't it? I mean, that's
exactly,
that's just inexcusable. Vicky, staying with you for a minute, the frustrations that you were feeling led you to become involved and to be a co-founder, I believe, of this Long COVID Netherlands. Can you tell us about that group and how you started it?
Yeah, so with Long COVID Netherlands, for the longest time, and I just say Long COVID Netherlands because this is one group. There are some. So there was a Facebook group for a long time, since I think about June or July last year. But that is mainly a support group. So it's not for sharing any scientific data. It's not for any medical advice. And we saw with my work group, we saw that a lot of people were actively looking for that. I mean, you can get support, but you still want to know what is going on with you. And try to kind of explain some of the symptoms that you're experiencing. So we really felt a need to start our own group, and also to engage in advocacy, to see if we can make some changes in terms of the policy and the types of treatment that were offered to patients. So in the beginning of this year, there was a petition that I actually just saw on Twitter. And I was like, oh, finally someone is doing something. So I immediately reached out to them. And based on that petition, we decided to form a work group. And this petition, we managed to get over 12,000 signatures over the last couple of months. And I have to say, like, for most other countries, that doesn't seem like much, but we don't have a big population. So for us, it kind of is a lot. And we accompanied that with basically doing interviews and making sure that long COVID was in the news every day for the last couple of months. So everyone in our work group, we've reached out to every single media outlet, every single politician there is, every healthcare organization, anyone that was willing to listen, and it worked because we were invited to present this petition 2 weeks ago. Sadly, that was all in person as well, because over here, of course, the rules are not that strict. So it was a very strange experience to go into Parliament to have these conversations, but in the end, it had a very good result. So there's now a plan that's being proposed by one of our democratic parties, the D66, for dealing with long COVID. There's a bunch of research studies that are now being set up, and we are being asked to also guide them on some of these studies. So there is a plan for active patient involvement, which we are really happy about. That was one of the demands of the petition. But there are still a lot of steps to be taken. We still see that in the Netherlands. Of course, we just went over how you have to get that referral from a GP. Well, that really means that you are completely reliant on the amount of knowledge that your GP has on COVID, and if they even know about the options that are there. So we still have a lot of work to do to make sure that GPs are well informed, to make sure there's some sort of program to educate them on long COVID. So we already had a lot of wins that we're really happy about, but we do see that there's still a need for a lot more.
Impressive, Vicky. Well done. I mean, that really is, to get into Parliament is pretty good. I mean, that is, you have my admiration. Absolutely, that's not an easy thing to do. And Ondine, you started Long COVID, or you're a co-founder. You and Sandra started Long COVID SAS. SOS. Sorry, yes, not Special Air Service. Yeah. So tell us again, what were the frustrations? How did that get off the ground?
Okay, so there were 5 of us to start with. Sandra actually posted sort of call to arms really in the support group to say, we've had enough of this. No one's listening to us. Yeah. No one's talking about this. We've got to do something. And I was very, very quick to join. We thought we would march on Parliament, but we were in lockdown, and most people couldn't really walk very far. We talked
so about ironic, isn't it?
It was ironic. We thought maybe a wheelchair march, but it was just too difficult to organise, and also, social distancing, it wouldn't have looked very good. So in the end, we decided to make a film. And this was our Message in a Bottle film, which has actually been viewed at least 80,000 times and has now been translated into 6 languages. And it's really emblematic, I think, of that period. And it was fantastic. It was made by some fellow long haulers who are filmmakers who are in our support group, and they did a fantastic job. And it really demonstrated the frustration and the fears and the endless wait that people were having to be recognised, to be noticed, to be cared for. So we released the film, and we also wrote an open letter to the Prime Minister. And that's how we started. We then ended up being contacted by the WHO, by Maria van Kerkhoff, who got hold of us in July. It was a couple of weeks after we released the film, and we organised a sort of conference, really, with members of the WHO. We had speakers from different countries, and we had some doctors with long COVID speaking. One of our members, Fran, talked about long COVID in children. Leith talked about his personal experience, and it was attended by, I think, 50 or 60 people, and it was quite a historic event. And afterwards, Dr. Tedros said, we've received your SOS, and we understand that you do need recognition, research, rehabilitation. So that was that was really quite big. And we've been working with the WHO ever since on getting the patient voice involved in their guidance on long COVID. So that's up until this day. So they've had 2 webinars on long COVID, and we've gathered together people from different countries to represent the patient body. In addition to that, shortly after that, we had a meeting with Professor Howes from the NHS, and we started a dialogue with the NHS, and we met with them. We still meet with them regularly, and we're members of the task force, and quite involved in again helping to get the patient voice heard, and for the right decisions to be made insofar as pathways, communications, treatment. On research, we have had quite a lot of dialogues with researchers, and one of the members of Long COVID SOS is working on PPI on one of the previously funded projects that were announced earlier this year. And a couple of us are involved in the UCLH study, which has just been funded, and I'm also involved in one of the immunological studies from Imperial College. So we're involved in research, and we've had lots of meetings with researchers and to help them put together their ideas for research projects. And the other side of our activity is campaigning. So we continue to write letters and to speak out for the rights of people with long COVID, and try to get it to the notice of people in government. We do our best.
Well, again, I'm just really impressed. Getting hold of the World Health Organization, seminars, NHS. I mean, excellent. I mean, very impressive performance. And of course, you're communicating with each other, which by definition shows we have an international link up.
Yes.
Vicky, you're clearly, from many perspectives, in an ideal position to understand the problems and to ask research questions. I mean, what are you actually researching at the moment?
At the moment, I actually cannot disclose anything about the
That's
study.
fine. That's okay. That's okay. Is there anyone can help? I mean, do you need volunteers or anything that can help?
Oh, not without disclosing.
Okay, that's absolutely fine. No.
I can say this though. Ondine and I have also worked on a study together. We did a survey together to see what the effects of vaccinations on long COVID patients were.
Yes.
Because we really wanted to see, first off, if the vaccines were safe for long COVID patients, or if patients would get worse because of it. And see if there would be any positive effects due to vaccination. We both saw in the support groups that we're members of that people were reporting that they felt so much better after getting the vaccine. And this was mostly happening in the UK because your rollout of the AstraZeneca vaccine was so much quicker than in other countries. So all eyes were on the UK specifically for long COVID to see how they would respond to it. And well, we decided to to do the survey. I think Ondine can best explain what the results were, because my knowledge of the English vocabulary doesn't stretch that far, I'm afraid.
I'm not convinced, but yeah, do tell us, Ondine, what were the results?
Well, I don't actually have them in front of me.
Just the gist.
The gist was we asked people to rate. We settled on 14 of the most common symptoms, and we asked people to rate their severity before the vaccine and after. And what we found was that 57% of people, if you added up all their scores and took the average, their scores did go down. So they saw some, and it could have been very slight, but it could have been quite drastic for many. So 57% of people improved. There were about 18% of people who did get worse. Unfortunately, we also looked at more carefully. We found that about 11% of people, all of their symptoms either improved or stayed the same, which was great, whereas only 3% found all of their symptoms got worse. Now, of course, the limitations of this study is that we were asking people at different points. So some people may have only been 2 weeks since their vaccine, or maybe a week. We did ask people to please wait at least a week. Some people were 6 weeks out. So it was very, very difficult to ascertain from that data how long lasting these changes are. And anecdotally, there are people who say, yes, I felt much better, but then within a few weeks, they're back to the baseline. And so that may be the case. And without a proper, a sort of real longitudinal study, it's going to be quite difficult to really come to any big conclusions. But we felt that the results did indicate that by and large, it was safe. There were people who did get worse, but not all of them. Certainly many of those who suffered worsening symptoms, those weren't long lasting, or they weren't permanent. But overwhelmingly more people improved. So we need more work really to find out what's going on.
Yeah, again, that's impressive. I mean, there's a few people watching have probably organised research studies. I've organised one, and it was a lot of work. I mean, that is, again, impressive.
Well,
to
there was
facilitate that is, yeah.
But we managed to get 800. So that was
I mean, that is a very good number. You get very valid statistics from a number of 800. That is good. Impressive again.
Well, we're hoping the preprint is in the Lancet preprints, and we're waiting to see whether it gets peer reviewed.
Well, and of course, any links that you want to put on, either of you want to put on, we'll put below this video for people's further viewing. Just a couple more questions, really, Vicky. I know you've been in contact through the group with many people in the Netherlands who've got long-term symptoms. I mean, I know there's not sort of a typical case, but I mean, what are, give us a sketch of the sort of long-term difficulties that people are commonly experiencing in the Netherlands.
It's the same list that you hear from every country, really. It's fatigue, it's neurological symptoms, it's the post-exertional malaise. I'm messing up that word.
But post-exertional, yeah.
Post-exertional, yes.
You feel very tired after you've exercised, yeah.
Yes, a lot of people still have breathing issues. They have inflammatory response as well. And we hear a lot from people that they are dealing with circulation issues as well. Right. These are really, I think, the most common ones. We also hear from people who already have some of their symptoms kind of grouped under a different diagnosis.
Yes.
I'm quite hesitant to connect another diagnosis to these symptoms, because I think in the long run it may actually turn out to be something different or slightly different than some of the existing diagnoses. But we hear about POTS, for example.
About what? Sorry.
POTS syndrome. Do I say that correct? I think it's called dysautonomia.
It's post-orthostatic tachycardia syndrome.
Oh, right, okay. Right, let's get this right. Post-orthostatic tachycardia syndrome. Right, in other words, you get this very, very fast heartbeat and palpitations, particularly
when you stand up.
Yeah, which is very so. After lying down, you stand up and you get a very fast and pleasant heartbeat. Yeah.
I hope I'm right. I think that is what it says.
Yeah, no, that sounds right. Yeah, okay. Yeah. Any other particular features you want to sort of mention, Vicky, that people commonly complain of?
Yeah, a lot of people still have a lot of trouble walking and have a
Yeah.
lot
Yeah.
of they lost a lot of muscle. And
Mm,
that is also something that you have to rebuild, which is difficult to do
it is.
when you get so tired after doing anything.
Yeah.
And that really adds to the existing list of symptoms that makes everything that much worse. Without muscle strength, it will be very difficult to actually get back into action or
Yeah.
try to regain that.
Yeah. People just can't return to normal duties. There's things they just can't
Yeah,
do.
and even when you asked me just now, so what symptoms are you still experiencing now? I feel like I left out more than half of them. One of the things that I personally am still suffering from is memory loss. So I really had a couple of moments that I've had full blackouts. That seem to be more common. I actually managed to fully block my debit card because I completely lost my PIN. I still cannot remember it, by the way. It's months later now, but it's situations like that. I'm like, well, I'm 29 years old. I shouldn't have a memory that is that bad that I cannot even remember my own PIN. And of course, that gets you into so much trouble, like even when using your phone or trying to unlock your computer. And I think that is something that we should shine a light on. I mean, it's now grouped under neurological symptoms, but it can be something much more severe, possibly. So I think that should be looked at more closely.
Things that people just take for granted that allow them to function normally in everyday life. All of a sudden, you're having the disease has sort of taken those away from you. It's pretty disconcerting. Undine, the symptoms that your group are reporting, that the long COVID SOS, similar to the Netherlands experience, similar to what Vicky's reporting?
Yes, I think it is similar. And what we noticed when we did the vaccine survey, the top 4 symptoms were exactly the same top 4 that the ONS found in their surveys. So, and that was fatigue, muscle pain, shortness of breath, and brain fog. And those are definitely the top. But then there are many, many more that are not far behind. And patient-led research recently had their study peer-reviewed, and that was published in the Lancet as well. They were working with UCL, and they've recorded 200 symptoms. And wow. I suppose, I mean, some people might say, oh, how ridiculous, you know, people are attributing everything to long COVID, and that is an argument that's often voiced. But when you consider that it's a multi-system, that COVID-19 is a multi-system disease, it's not surprising that it can affect you top to toe. I mean, you know, when I started getting the COVID toes, I couldn't believe it, really. It was out of the blue. But
how long after your initial symptoms was that, Andy?
Months, absolutely months. It was probably about 8 months.
Wow.
Something like that, 7 or 8 months. And it's really, it's got better. And I thought, well, maybe it's just spontaneous, but so many people have the same thing, and they're all different ages. So unfortunately, I think sometimes when people talk about hundreds and hundreds of symptoms, in some respects, does it make the illness seem less believable? But this is the fact. When we do have the main symptoms, but it can impact all of your body. And if it is an autoimmune disease, I think that's quite common, particularly things like rashes. And of course, going back to the psoriasis, which is autoimmune, there's definitely a massive autoimmune component. Of course, we still don't know for sure. But it can impact you in so many different ways. And it seems in the same way that the acute infection tends to go for people's weaknesses. You feel like it gets you where you're weak. And long COVID will do the same. So if you're inclined to have maybe rashes, or you're inclined to have whatever your weakness is, it will get in there.
Finds them out. Did you want to say something there, Vicky?
No, I completely agree with that. I mean, the only, you asked about underlying condition or underlying symptoms earlier, and the only thing I mentioned this earlier in other talks I did as well, the only thing I had was a rash on my hands. I thought it was a sun rash. And of course, the first symptoms I get are all like, a lot of it is focused on skin condition. The rash I had all over my upper body, I still have the rash all over my hands right now, and on my feet. So yeah, it makes perfect sense that that COVID really looks for your weak spots.
The idea, Undine, that you get so many, and Vicky, the idea that you get so many different symptoms doesn't really surprise me, because obviously in medicine we call this a syndrome. I mean, that's well known. It's a constellation of syndromes, of signs and symptoms. And if it's in the context of this underlying illness, then yeah, it doesn't surprise me that there could be 100 different possible manifestations or more. This is a syndrome condition with numerous possible manifestations. Of course, the interesting thing will be, is this related to a common underlying pathology, or is there many, many different things going on here? But
yeah, there are different views on that.
Yeah.
That NIHR have suggested in some papers that you could hive off post ICU syndrome as being a different type of long COVID. It is probably different because it's maybe caused by the experience of being in ICU and the drugs you've taken. I think it's very difficult. I think it's a bit of a continuum. I mean, fatigue seems to be impact so many people that I don't think you can say, well, it's, you know, for some people it's just post-viral fatigue. It's not. It seems to be much more complex, and that makes it so difficult to treat.
I mean, but the fatigue that we're talking about is not just feeling a bit tired, is it? It's a complete inability to get off the couch. Or
and of course the post-exertional malaise makes it even worse, because you think you can do something and then you're punished afterwards. You know, may put you in bed for a week. I mean, this is something that is common to people who have ME as well. And so, of course, there is a lot of contention that it may be like ME or it may not be like ME. But I think the jury's out on that too, because there are certain things in common. There's no doubt about it, and the ME is often apparently caused by a virus. But we're dealing with a virus which is so novel, apart from the original SARS. And I think you can't make any assumptions really. And it's great that there's so much now being invested in research.
Indeed,
yeah. Some answers.
What's your thinking on that, Vicky? Do you think there's a relationship to the existing ME sort of chronic fatigue syndromes that are known about already, or?
I think there could be, but I'm hesitant to already make that connection and talk about it in such a way.
Yeah, right.
I think more research is necessary, and like Undine said, I think it's very important to kind of divide the group of long COVID patients into 2 or more groups of people, like grouping symptoms to see how a set of patients respond to something, or if they have any underlying conditions, because we also see in the type of data coming out of some studies that there's a clear difference between people that have ongoing symptoms for half a year or longer, or people that are recovering from their hospital admission or just initial disease. So just also to make sure that we don't have any skewed data, that is really important, because yeah, if we don't, then we may actually get wrong results, and results that may actually result in treatments that are not as effective for patients. It may be harmful. So I think that is something to keep in mind here.
Certainly. And do you think, Vicky, that some people might have particular symptoms because of tissue damage to a particular organ? So in some people it might be the heart that's actually damaged, or the lungs, or the kidneys, giving a slightly different presentation. Is that possible? Yes,
I'm pretty sure. And I actually know these different types of long haulers as well. Actually, a good friend of mine also has long COVID, but she clearly has damage to the heart and to the lungs. While there are others who don't have any organ damage. So this really is something to keep in mind, and also in how to kind of talk about the different sets of symptoms, because if it's just that initial damage, people can recover from that, and they shouldn't. There is not necessarily that same need for that group to get this long-term treatment that we are advocating for. But you have to be very careful about this because you don't want to offer treatment to only a group of patients and thereby making sure that the rest of them are not being taken seriously. So it's really, really important to be cautious about this, to not dismiss any of these symptoms, because we see that happening as well. Like Ondine said, like people think, oh, it's just a little fatigue. No, also the people who don't have this organ damage, who are not short of breath, who don't have inflammation, they still report this because it really affects their day-to-day life. And so I think it's most important to not dismiss any symptoms, but to also not just group all the patients together as they all have the same thing.
I think the problem with fatigue is that it's not very well researched, and it could be caused by all sorts of different things. So someone, you may say, oh well, post-viral fatigue, but that fatigue might be neurological, or it could be caused by a cardiac problem.
Certainly.
And we don't really know. And so the problem is that many people who do mainly have fatigue are sort of being referred to app-based treatment or telephone-based treatment, and they're not getting properly assessed. And I think it's, obviously you can't do a complete workup for everybody who's got long COVID. It might be impractical to do that, but I really think the red flags need to be followed up. And there are plenty of people with chest pain who have ongoing chest pain and still haven't had the right sort of investigations.
Yeah, I mean, as an A&E staff nurse, chest pain to me was an absolute red flag. You get them straight in as soon as you can. You do the basic investigations, and you get someone very senior to see them straight away. It's
Yes,
the idea that you just ignore a chest pain for a period of time terrifies me.
Well, yes, I mean, when I heard people suffering from this terrible chest pain, it seemed crazy, but they do have the basic test, the ECGs and the X-rays, and they're given the all clear.
But as you've said, they are not sufficiently powerful enough to differentiate the particular pathologies that we are, new pathologies presumably, that we're dealing with.
Yeah.
Just a couple of questions left, really. Vicky, internationally, are you expecting to see the same sort of pattern in different countries that have had the same kind of incidence of SARS coronavirus too? Would we expect to see this in Brazil, in the States?
I expect the prevalence to be around the same, although I do think that there may be some differences in countries in terms of how people live. And therefore, if they're if they would get long COVID, but of course, for that we need to know more about the whole mechanism behind long COVID. But in terms of how governments are responding to this knowledge, I think the response would be very different. Of course, in the UK and in the Netherlands, we are able to get care, at least to a certain extent, although it is much more difficult now for long haulers to get that care. But in general, it is a possibility. But there are so many countries around the world where it's much more difficult to get any type of care. And then if there is any care, then it's acute care. And this is specifically something that it is not seen as in need of any acute care. And so I think there will be a lot of countries who will try to ignore it. We already see that happening in the more richer countries. So it actually makes me very, very afraid of what will happen in these countries that don't have these health systems in place. We have contact with some long haulers in Chile, for example. It's been impossible for them to get any care. Even people who have very good connections with the government, who have worked for the government, are not being taken seriously. And of course, this is a global issue. So it's really dependent on if your government acknowledges it, if there is a plan in place to actually help the patients. And I fear that some countries will actually not implement anything that would help patients. So that is why we do what we do. I think it's to help the patients in countries also that don't have that information to educate themselves. There are so many things that you can do as a long hauler that could harm your situation. And we are really trying our best to provide the right information so that at least these patients don't get worse because of anything they do or anything they hear. There's a lot of misinformation doing the rounds about miracle drugs. Of course, we have to make sure that people are well informed and that they at least know what they should be asking for, know how they should take care of themselves. And that's what we'll continue to do.
Yeah, I mean, our work with our conversations with the WHO do include, we're concerned that low and middle income countries are not going to be in a position to be able to help huge numbers of people with long COVID. I mean, it's hard enough to deal with the acute, with those in the acute phase. And of course, it's the same in the UK, that there's almost certainly going to be a social determinant of health when it comes to long COVID as well. And a lot of people in hard to reach communities may not have that knowledge, may not even realize that what they're suffering from because of the lack of information.
Yeah, we have to get this idea that this is a real disease syndrome and treat it on the basis of that reality. Talking about treatments, Ondine, anything sort of hopeful that's on the horizon treatment wise, or?
Well, the UCLH study is going to include a treatments work stream. So they're going to be looking at repurposing drugs, which have looked promising in the UCLH clinic, and hopefully other drugs to try and find treatments. At the moment, drugs are being used to alleviate symptoms rather than produce a cure. But maybe once we can get to grips with some of the mechanisms, we might be able to have targeted treatments which will be able to help people. I really hope so, because if we can find treatments for autoimmunity, it could help other autoimmune diseases, and of course could also help people with ME.
This could be the silver lining to this, couldn't it? That there's research has been done, and hopefully it could extend to other people with post-viral syndromes and chronic fatigue of various types.
Certain things have been proven to be useful, such as breathing exercises have really helped people with voice exercises, help people. A lot of people have trouble with their voices. I mean, there are things that can help. And in fact, one of the problems is getting that information circulating so that, one clinic may have found something useful that needs to be disseminated to everyone, all the other centers, so that everybody can benefit. So it's a matter of, it's not only finding the treatments, it's sharing that information worldwide if possible. I mean, so we need a sort of worldwide information hub.
Absolutely.
For long COVID.
No, absolutely. To collect data, collect information, make sense of it, and then get it back out there again is a yeah. Vicky, you were going to say something about treatments or possible ways forward.
Here in the Netherlands, I have to say our scientific community is a little bit smaller than in the UK or in the US, where I work now, or where my work is located, I should say. So the studies that we have going on in the Netherlands, I think are mostly what is already being done in other countries. We are involved in some new initiatives, so we hope that we can kind of steer that in the right direction. But as of yet, we are kind of a couple months behind the UK in terms of research. So our hope is that we can speed that up, and we share everything that is already being done, or as much as possible, with those organizations that now want to start new research, just to make sure that we're not doing any double work. Because we see that happening in a lot of countries, that they first start off with that same study, seeing, what is the prevalence of long COVID? Well, we already have some idea of what that is. So do we really need to have that same study in every single country? We have to make sure that we're also not wasting very precious resources in terms of funding on things that we already know. So what Ondine just mentioned, we really have to share this information widely, not just the results of some of these studies, but also which studies are ongoing, so that everyone has a clear view. There's one space to go to see if a particular thing is already being studied. I think there's a real need for that.
And you're helping with that, Vicky, which is just brilliant. There's no point duplicating effort, and this needs to be internationally coordinated. It's one enemy. The virus and this post-viral syndrome is the enemy.
Exactly.
Yeah, exactly. So finally, Ondine, anything you'd like to say in conclusion? Undine first.
There's so much, really, isn't there, to conclude? We're so far from a conclusion, aren't we? Because we still know so little.
It's the first page, really, isn't it? I'm afraid.
Yeah. I mean, we're still, even after a year, we're still working on recognition, because not everybody really accepts that this exists.
Yes.
And not everybody knows about it. So we're not finished yet. There's a lot more work to do.
Let's get this out there. People are telling us this is real. There's pathological evidence that this is real. This is a real problem. It's a real disease, just the same as malaria, just the same as appendicitis, and it has to be approached in that way. Absolutely. Let's hope that message is strengthened. Vicky, anything you'd like to say in conclusion?
Yeah, kind of to add to that, I mean, we are in the fortunate position that we both live in countries where long COVID is acknowledged, officially acknowledged by our governments, but there are very few countries around the world that have acknowledged the disease. Aside from us, I think there's Belgium and Italy. I maybe forget about some, France as well. That's good to know, by the way. But yeah, there are a lot of countries where we're still in that beginning phase of getting that recognition. And also in countries where it's less accepted to speak out, and so or that don't have that reach to get a bigger audience or to get to the right people. So that is something that we'll focus on in the coming weeks, and also to set up support groups, like you said, in communities that are harder to reach. I think that is very important, specifically to get that information in your own language. If something like that is not done in that country, we will try to make sure that there is something in place, or someone is willing to do that. Because patients need help. They really do. And yeah, I think it's for both of Undine and me. I can for sure say that we will do everything in our power to provide this support.
No, that's great. Thank you. And of course, we'll be posting any links that either of you would like to post to guide people onto further resources. Of course, they'll be in the description, so we'll certainly post that. So, Undine and Vicky, I know this has been quite difficult for you. I'm really impressed by the way that you've both been prepared to self-disclose. Because talking about your own suffering is not easy. It's a hard thing to do, and you've both done that. But I think people will benefit from it, and it's just really impressive, the achievements that you both had, despite the tiredness and the other ongoing pathologies that you both achieved so much in terms of organisation and liaison and getting to World Health Organisations and governments and national health services, and that is really good. So for the effort you've put in, both of you this afternoon, I really appreciate that. And people can tell us what they think and click on your links, and that's sort of the story so far. So thank you both very much. And of course, if you'd like to come back at any point and give further information, you'd be more than welcome. So thank you both very much indeed.
Thank you very much,
Thank
John.
you for having us.
Thank you.
Great.